Hello, Dr. Vicki Peterson here. Yesterday I did a video on the adrenal glands. The adrenal glands are your stress gland. I mentioned that they have a lot to do with energy level, stress load, whether you feel anxious or depressed, if you have trouble sleeping. They can cause you to feel achy in your joints and muscles. They can cause hormonal imbalance. Because they're really related to the thyroid, the thyroid and the adrenal glands can kind of play off one another. So sometimes people with low thyroid really have adrenal stress as well, and that's not often looked at. And so there's a lot of things that the adrenal glands do when it comes to anti-aging, something that we're all interested in at some point. The adrenal glands are actually the gland in the body that's responsible for anti-aging. How do they do that? They repair. They're all about repair and rebuild. So for no other reason, you would want them to be happy for that. But they also make natural anti-inflammatories. And inflammation, we now know, is really the generator, the forward motion behind the degenerative diseases we're all trying to avoid. So having anti-inflammatories be produced by the human body in a good abundance is a very healthful thing, and another reason the adrenal glands are responsible for anti-aging. So we did a little bit of an overview of that yesterday, but what I didn't get into, just because I try to kind of keep these videos not too long, are some lifestyle factors and things you can really do if you feel you do have weakened adrenal glands. So once again, the hallmark is not enough adrenaline, so the adrenal glands make adrenaline, and so fatigue and, as I said, achiness, sleep problems, etc., that list that we just reviewed are really the hallmarks. And too often, why is it missed? Why are adrenal glands overlooked so often? Because they don't disease frequently. They do, but it's very rare. And in our environment, we're very disease-oriented. Our medical profession is very disease-oriented. They want to put that label of, yes, you have X disease, and for X disease, there's Y drug, and that's kind of the way it goes. In root cause medicine, we work very, very differently. We want to get to that underlying root cause of why the body's malfunctioning. And a gland like the adrenal glands can malfunction even though they'll never get diseased, because, as I said, the disease is quite rare. So most of us will never get to adrenal disease, which is great, but a very high percentage of us actually have malfunctioning adrenal glands. And as I mentioned, we've got those symptoms. Another one is feeling lightheaded, or just kind of like almost the life force is drained out of you, you know. I used to have this very badly. They say you inherit your adrenal glands from your mother, and my mother had a terrible case of adrenal exhaustion, so much so that she actually had a tumor on one of her adrenal glands, and it was removed. But she had two, thankfully. And so she's done quite well, and she's 91 and is on no medication, so she's done very well, even though she's had one adrenal gland, because we've done a program to help her out. So here we go. What are some of the lifestyle things you really want to look at? The first one you're not going to be happy with, which is caffeine, if you're into that. Because a lot of us, when we're tired, what do we want to do? We want that lift. We want to get it from somewhere. So caffeine is a ready source of that, as is sugar. And we like to liken that to beating a dead horse, meaning the adrenal glands, if you give them a stimulant, you're causing them to work very hard, and then when they fall flat, when that stimulant comes out of your system, it's really making them weaker. It's putting more stress on them. So caffeine is actually one of the first things that leaves the equation when we work with patients with weakened adrenal glands. There is a functional test, by the way. It's a salivary test that we utilize to assess what kind of shape your adrenal glands are in, and if you need more information about that, feel free to contact me. But you could be normal, it could be in phase 1, phase 2, or phase 3 adrenal exhaustion, and this lab test will help discern that for us. But the caffeine, not your friend, sorry. I know it can be rough getting off of it, but in a few days, just usually 3-4 days maximum, 4 on the very outside, typically 3, and you're past it. Sugar, same thing, it's a stimulant, so it's kind of hard on them. Now, exercise. So exercise is great, but what if you're that person that exercises and you might feel great while you're doing it, and then the next day you feel like a truck ran over you? That means too much. It also means your adrenal glands are not happy. And I'm not saying you ran a marathon. That would be different. You probably deserve to feel like a truck ran over you. I'm just talking about day-to-day kind of normal exercise. And you might feel good when you're doing it, and then the next day you ache all over and you feel like, you know, you just feel terrible. So A, that was too much for you, and B, if even just a little exercise does that, we know your adrenal glands are in a weakened shape and we need to do something about it. The good news is that the adrenal glands don't like drugs, they don't like surgery when it comes to this malfunction state, so a natural program is what they do best with, which is great, so you don't have to worry about any scary drugs. So what if you exercise a little bit and you feel okay, all right? So good, some exercise for you is good. Now the timing of it. You don't want to exercise at night, especially if you have any trouble sleeping. But if you have any of these symptoms of adrenal exhaustion, at night your adrenal glands should be settling down. They should be winding down. The adrenaline levels fall down so that the sleep hormone melatonin can come back up, right? So you can get in a nice deep restorative sleep. So for you, you don't want to be exercising at night. Sometimes people say, oh, if I exercise, I get so exhausted, I fall asleep. But then sometimes a few hours later, they find themselves awake and they can't get back to sleep. So we want it at the front end of the day. Remember, it's got to feel good and not feel terrible the next day. And as long as that's okay, the timing of it is in the first, either upon arising, which is great, or at least in the first half of the day, okay? As far as diet is concerned, you really want to find out if you have any food sensitivities, whether it's gluten or dairy or corn or soy, whatever it is. The adrenal glands do make that adrenaline. They need that energy that comes from our food in order to do all the functions that they do, and they do 2 pages worth of functions for you. They're little, they're just the size of a walnut, but they do a tremendous amount for us. So we need a good energy level, and that comes from good food turning into fuel. So of course, if you're eating something you're sensitive to, that's not happening. You're not getting that fuel delivery the way you should. And one of the most common things we find with patients with weakened adrenal glands is a food sensitivity. So you want to get that diagnosed. Once again, if you need help, let me know. The second most common thing we find is actually infections. So these are infections often in the gut. They come about often secondary to food sensitivities, which weaken the strength of the immune system in the gut. Remember that 70 to 80% of our immune system is housed in our small intestine. So if we're eating foods that don't suit us well, that immune system gets diminished, and then little opportunistic bacteria and viruses and amoebas and parasites get a foothold in the gut, and they can really wear on the system. So that's another very common thing we find. Now that one does require a lab test. There's really no other way around that. I know I'm very frequently asked, just tell me what to take. What do I do for this? I wish it was that easy, you know. I mean, I'm definitely going to give you some ideas of things to take that are safe and all of that, but I would be doing a disservice and I would just turn into a commercial if all I said to you was, oh, you have these symptoms, take this, and I'd be a liar on top of it. So I'm not. So I have to tell you the truth, right? I have to tell you what really works, because we've been doing this for a long time and we have a great workable program for the adrenal glands. And as I said, there's a lot you can do by yourself, but there's some things you might need help with, and it's not about just swallowing something. Now, there's a lot of adrenal supplements out on the market that are glandular, so they actually come from the adrenal gland of another animal. And that might sound gross, but I used to use those because back in the day, and I'm going back 20 years now, 15, 20 years, it was considered a good way to go about it. We now know better, at least, well, a lot of us know better. So if you're being prescribed a glandular for your adrenal weakness, don't do that. Go another route. It's been proven not to work. I, who had terrible adrenal glands, lived on glandulars for years, and they sort of help, but then I couldn't ever stop taking them, and then I'd fall flat again. So that's not root cause, right? If you really get to the root cause of something, then it's fixed. So mine are fixed. You can probably tell by how fast I talk. Anyway, so the other things, we talked about food sensitivities. Obviously, if you're eating a poor American diet, that's putting stress on the adrenal glands because there's so much sugar and caffeine and artificial components and preserved foods and fast food, and so the adrenal glands don't like that. If you have any thyroid disease in your family, or you yourself have any thyroid disease, think about the adrenal glands, because those two work very, very closely together. So you want to support the adrenal glands if you have any thyroid issues. Now I have there's a supplement we do like. It's called Phytozone, which is Phytisone. You can get it online. It's got C in it, it's got B's in it, it's got some herbs. Licorice root, not just licorice, but licorice root is very healthful and healing for the adrenal glands. Ashwagandha is an herb. There's ginseng. Certain types of ginseng are very good. You don't want to take a supplement where you go, wow, it's like a cup of coffee. It shouldn't be like that.